Welcome back to ABC-7 at 4. I'm Mark Ross. Well, when you're looking for information about a health issue or illness, where do you get it? Chances are you're turning to Dr. Google. But how reliable are the sources you find? October is Health Literacy Month, and our medical contributor, Dr. Ogechika Alozie, a real doctor with Sunset West Health, is here to help you be more health literate. First of all, doctor, what are the effects of not being health literate?
Well, I think the main thing is it affects your sort of global understanding of what's happening with you. You have a parent, I have a parent, multiple of our listeners have parents, and if you don't know what's going on, you can't help your parent navigate the healthcare system, and I think that's critically important.
Now, it's been determined there are some groups of people who are less health literate than others. I mean, we're talking about 9 out of 10 adults who have difficulty understanding health information.
Absolutely. And so I think this is not a question of are you educated, aren't you educated? Is it socioeconomic status? All of those factors affect it, but they're not the primary drivers. As you and I have talked about before, our parents, they're older, right? And so they may not understand the lingo of healthcare. They may not understand the technology of healthcare. People that don't speak or read English as a first language happens in our environment. People in low socioeconomic groups in education. Those aren't the only factor, but they are factors that affect how you input and how you take health education.
So what are the benefits of improving health literacy?
I mean, for me, the biggest thing is just understanding what's going on. Until you can understand what's going on with your health, you can't own your health, right? You have to understand it and own it, to acknowledge it and take the next steps. The minimalist piece is just your medication. If I give a prescription to somebody and they don't understand what it is, why they're taking it, how they're taking it, when they're supposed to take it, they can't take it properly to help them with what they need to do. There are a host of other things here, but I think those are some of the biggest ones.
But this leads into my next question, sir. What should you do when it comes to visiting your doctor? You have 5 suggestions here.
Absolutely. So I think one of the biggest things is prepare for the visit. You may say, well, how do I prepare for a visit? You have questions, write them down, whether it's on a piece of paper, on your phone, or on your tablet. How have you been taking your meds? What have you missed? Take note or ask for materials. Almost every healthcare organization and clinic you go to has all these printouts. A lot of them aren't great, but they're better than nothing. I think some of the other things to sort of think about too is make sure you're understanding the message, right? When your doctor or clinician is having a conversation with you, understand what they're saying. Ask questions. Don't feel rushed. You have to be comfortable with the information that you're being given to process it and take the next steps.
Yeah, that is your time with the doctor, so make sure you take the most advantage of it that you can.
Absolutely. Absolutely.
All right. Well, as I mentioned at the beginning of our segment today, finding reliable health information online is a challenge. You have a little thing you call A, B, and C.
Yes, the authority, bias, and current. I think authority is what kind of website is it? Is it from a reliable source? Google is not necessarily a reliable source. Is there bias, right? Is this somebody that's going to tell you to take leeches for COVID or to take iron for cancer? That's not what we're talking about. And is the information current? If you're going online to look at something, scroll to the bottom. It has the date. If we're talking about 1982 information in 2023, that's not it. Gov.edu, forget about the advertisements. And again, reliable websites, like I say, put their publication date at the bottom.
Speaking of reliable health information sites, here are a few.
Yeah, there's a lot of them out there. Obviously, a lot of people know what the Mayo Clinic is, the National Institutes for Health, CDC. There's some others up there. I will say, and this is not just to our listeners who are patients, but to my colleagues that are physicians and clinicians, break it down for patients. This should ideally be at a most a 5th grade level so that people can understand it. We need to do better so our patients can get better.
ABC-7 medical contributor Dr. Ogechika Alozie, some good advice as always, sir.
Thank you, sir. Appreciate it.